Welcome to another session of the RSCP. Today we will be discussing gallbladder imaging. To review, the gallbladder resides under the liver in the right upper quadrant of the abdomen, and its purpose is to regulate, store, and concentrate bile between meals. The normal size of an adult gallbladder measures 7 to 10 centimeters in length and 3 to 4 centimeters transversely. The schematic on this slide illustrates the important macroscopic anatomy of the gallbladder. Emerging from within the liver are the right and left hepatic ducts. These converge to form the common hepatic duct, which then shunts bile into the bidirectional cystic duct. Eventually, bile exits the biliary system by way of the common bile duct into the enteric system. The gallbladder is divided into the fundus distally, body medially, and neck proximally. Today, we will discuss the most common gallbladder imaging modalities and what to look for on each. To start this conversation, I will review acute cholecystitis, as it is the most common pathology on any differential when concerned about the gallbladder. Acute cholecystitis refers to gallbladder inflammation that can be subdivided into calculous and acalculous cholecystitis. Acalculous cholecystitis is far less common and mostly occurs in chronically ill patients. The typical patient will present with the triad of right upper quadrant pain, fever, and a positive Murphy sign, or meaning sudden inspiratory pausing on deep palpation of the right upper quadrant. The initial imaging study to evaluate cholecystitis and most other gallbladder pathologies is right upper quadrant ultrasound. If ultrasound findings are inconclusive, then a HIDA scan, abdominal MRI, or abdominal CT should be considered to confirm the diagnosis. On ultrasound, we look for signs of gallbladder wall thickening greater than 3 to 5 millimeters, distension, gallbladder wall edema, sonographic Murphy sign, and pericholecystic free fluid. It is also helpful in identifying gallbladder neoplasms. On the left, the red arrows point to hyperechoic gallstones layering the inferior aspect of the gallbladder, with associated posterior acoustic shadowing indicated with yellow arrows. The red dotted line on the transverse view of the gallbladder shows the double wall or hypoechoic appearance on the gallbladder, which suggests edema. A HIDA scan can also be performed to evaluate the gallbladder. While it is not the first-line imaging study, it is the gold standard. A HIDA is performed by injecting radioactive tracer intravenously. Hepatocytes selectively uptake the radiotracer and then excrete it into the bile. If the cystic duct is patent, radioactive tracer can be visualized inside the gallbladder with a gamma camera. If the study is normal, the gallbladder will be visualized within 4 hours. If the gallbladder cannot be visualized within 4 hours, then the patient is diagnosed with acute cholecystitis. MRI imaging is less frequently ordered to assess gallbladder pathology, but when reviewing the gallbladder on MRI, look for hyperintensity of the gallbladder wall and pericholecystic region on T2 weighted imaging. You may also be able to visualize gallstones, perforation, or empyema. MRCP is a non-invasive study useful for evaluating the bile ducts. An ERCP, on the other hand, is an invasive study used to diagnose strictures, stones, and neoplasms of the biliary system. It can be diagnostic and therapeutic at the same time. Importantly, ERCPs are associated with an increased risk of pancreatitis. On CT, look for hyperattenuating gallbladder walls and gallstones. You may also see polyps and occasionally biliary sludge. The CT scan is very good at identifying gallbladder cancer, specifically the size, local invasion, and areas of metastasis. The image on the right demonstrates acute cholecystitis. The red arrow points to a stone in the cystic duct. Finally, plain films may be used to visualize calcified gallstones, but with limited utility as calcified gallstones occur less than 10% of the time. To recap, a variety of imaging modalities may be used to evaluate the gallbladder, but ultrasound is the preferred initial study. That concludes our discussion of gallbladder imaging. Thank you for tuning in.